Hi, I'm Dr. Christina Wu. I'm a GI medical oncologist. I'm also an associate professor in hematology and medical oncology at Emory University Winship Cancer Institute. So the question is for patients with diabetes who have pre-existing neuropathy and people who've had a history of heart attacks or what we call coronary artery disease, is it safe for our patients to receive chemotherapy called FOLFOX, which is 5-FU oxaliplatin, or FOLFIRI, which is 5-FU and irinotecan? So I'll tackle the diabetes and neuropathy question first. That's a great question because 5-FU oxaliplatin is often given, and the oxaliplatin chemo drug can cause peripheral neuropathy. This neuropathy is where there can be numbness, which can start as fleeting numbness and tingling in the hands and the feet. But after a few months of the therapy, it can become more persistent and can eventually become even painful if patients are continued on oxaliplatin. So this is a real challenge and question for our patients who may already have pre-existing neuropathy. I think the best thing is to have a good assessment between the patient and the oncologist about the level of neuropathy that you already have. If it is some numbness and tingling that's not necessarily affecting your activities of ADLs or activities of daily life, we can consider still treating you with the 5-FU oxaliplatin chemo regimen. But yes, we would consider some dose reductions. And for my patients who don't have pre-existing neuropathy, we do talk about dose reductions as patients start becoming more symptomatic if they are developing numbness and tingling that's sticking around. So I think this is a great question to have with your oncologist and something you definitely should bring up. If you have metastatic colorectal cancer, you may opt to not start with the oxaliplatin chemo regimen and actually start with the 5-FU irinotecan chemo regimen, because the irinotecan would not cause those neuropathy issues. So I think yes, having that discussion and tailoring a treatment plan to you is very important. The second question about heart attack and heart disease, for the general population who do have heart attacks and heart disease, it is a safe chemo regimen to offer our patients. 5-FU oxaliplatin and 5-FU irinotecan do not cause heart damage. However, in a very small population, probably 5% or less of patients can develop what we call coronary vasospasm from the 5-FU infusion. And how patients experience that vasospasm is there can be chest pain when they receive that 5-FU. And it's reversible. When you stop the infusion, the chest pain goes away. But this is a real serious side effect if it should happen. And having heart disease does not mean you're definitely going to get this side effect. It's often not predictable. But it's important to know that that can be a side effect. And if that happens, that the first thing to do is call your doctor's office and stop the 5-FU infusion pump. Now, if there is a suspicion of this very uncommon side effect, usually I do have my patients undergo a cardiology exam, meaning I get generally at minimum an echocardiogram to see how their heart's pumping and have one of my cardio oncologists evaluate my patients. And then based on the symptoms, we can decide if we can safely re-challenge our patients with 5-FU and additional medications that can help prevent that vasospasm from happening. Sometimes that re-challenge can happen at home as an outpatient. Sometimes we bring our patients into the hospital for our observation in those situations. But again, I want to stress this is a very uncommon side effect. And majority of our patients, even with those who have heart disease, are able to safely receive chemotherapy.